Hi, good day. We are Group 12, and our topic for today is Management of Alcohol Withdrawal in Emergency Department. My name is Karen Lloyd, and along with me are my group mates Mary Ferrier Don, Alona Ponce, and Adrian Pahar. Okay, for the brief introduction, we choose this topic because of its umbrella effect. The alcoholism is one of the least priority cases in the emergency department, but tends to be one of the major concerns when patients fall in the category of alcohol withdrawal, as well as the medical condition that the patient develops as a result of prolonged ethanol abuse. A person with chronic ethanol consumption can have multiple health conditions over the years, but if their alcohol intake was resolved from the early stage, then their risk for health problems will be lessened. Um, According to Canadian Center on Substance Use and Addiction, alcohol use is a leading preventable cause of death, disability, and social problems, including certain cancers, cardiovascular disease, liver disease, unintentional injuries, and violence. Since alcohol beverages are very accessible to the market, consumers take more than what their body can absorb, leading to some serious complications such as liver, kidney, and mental problems. This affects the patient's ability to maintain a healthy lifestyle and perform their day-to-day living and their ability to make decisions. So, what is alcohol withdrawal? Alcohol withdrawal symptoms occurs when patients stops drinking or significantly decrease their alcohol intake after long-term dependence. Since ethanol in the blood depresses the central nervous system, the body gets used to the state of prolonged exposure to the present. When the ethanol level is reduced due to the absence of alcohol intake, the body gets overexcited, leading to alcohol withdrawal syndrome such as tremors, nausea and vomiting, and a lot more. So, what is the relevance of the topic to nursing? Unfortunately, as a result of this abuse, the patient's body inhibits their health deterioration that affects their daily living or mental ability to live with optimum well being and would be challenging or most of the time impossible to restore. Our role being a nurse will be significant in detecting changes to their condition, providing care, as well as advocating for them. Why do we need to know how to manage patients with alcohol withdrawal? Majority of the abusers will not admit the fact that they are in the state of alcohol dependency until their drinking habits progress, causing damage to their organs, warranting them to solicit medical help. This is when the skills and knowledge of healthcare providers will take place. Because of the vital role of nurses in patient care, it will be beneficial to be knowledgeable on how to provide care, dealing with addiction, its related problems, and recognizing when there are signs and symptoms of withdrawal syndrome to collect important data and provide appropriate care to patients. The next speaker is Adrian Pahar.
Hi, I'm Adrian Bajar. I'm discussing the nursing practice impacting patient care on our CIWA protocol. Now, let's start with the purpose of the CIWA protocol. It's to prevent the occurrence of seizures on our patients that come into the emergency department with alcoholism or alcohol withdrawal syndrome, or patients with high alcohol levels in the blood already. Now, on the utilization of the CIWA protocol, that's depending on different facilities, but from our facility, we use a 15 score scale. In every facility, it would determine of how many times you will assess the patient, and when you give medications, and how will you lessen the monitoring um, frequency of the CIWA protocol of the CIWA assessments, depending on the score of the patients. Now, um, for management, let's say if the patient develops seizure, of course we will have to follow our safety protocols for our seizure um, occurring patients. We will put them on the left side to help them breathe better, then remove restricted clothing. And for medications, we administer lorazepam, diazepam, and clonazepam. If the patient is currently having seizures, then we give it through intramuscular. If not, then we give it orally. That's my part. And then I'm going to introduce the next speaker. It would be Alona Ponce. Thank you.
Okay, so my name is Alona Ponce, and I'll be discussing the best practice position statements and competency statements and policies from a professional nursing association. So when do we utilize the CIWA protocol? Utilizing the CIWA protocol, identifying risk factors by healthcare workers plays a vital role with regards to the patient's care outcome. Once all the necessary information is gathered, classified, and tabulated, the parameter will give us scores that can aid us in determining the level of therapy that we can give to the patient. So actually, the treatment for the patient depends on how long have they been taking the alcohol, and also it depends on the score. So if their CIWA score is 16 or higher, they usually present moderate to severe symptoms, which may need more comprehensive treatment, such as IV fluids and multiple drugs, compared to those patients whose score is 7 or lower. Through these parameters, a specific care plan can be monitored and modified at a given time if needed to the patient's response to treatment. So with regards to the medication, with SHN, the primary medications that we use to treat alcohol withdrawal is diazepam and lorazepam, with a maximum of 80 milligrams per day. This is to avoid the any. This is to prevent any seizures, and also if there are referred for long-term treatments, we usually use naltrexone, Campral, disulfiram, and Topamax. Before these medications are given, they usually have to undergo blood work. Sorry, and they actually should be negative from opioids, because some medications are can have effects to their liver. So when the patient comes to the ER, they usually come from triage to the room. So what happens is that we change them into a gown, make sure that everything is stripped out. We check their vital signs. We do head-to-toe assessment and health history. We have to attach them to the monitor as well. And after that, we have to do some blood work, including urine drug of abuse, serum drug of abuse, including ECG. Then the doctor assess the patients, and if they're positive with alcohol and with symptoms, the order starts to order the CIWA protocol, and then the nurse as well will use this questionnaire in assessing the patient. Usually, if their score is like below 10 rather, we just give prophylactic medications, which includes the multivitamins, the thiamine, and a dose of diazepam. If their score is like 16 or higher, CIWA is performed every hour, and medications is given according to their parameter. So CIWA is according to the patient's score. So if the CIWA is below 10 times 3 consecutive times, the monitoring stops. So also the we need to administer the following medications every hour as well when the CIWA is score is at least 8 to 10 points. My colleague Marifa is gonna be reporting regarding CIWA recommendation and impacts and implications.
So my name is Mary Ferrierdon, and I'm going to discuss the recommendation to SHN Hospital regarding the patient with alcohol problem. So the recommendations in the SHN Hospital for those patients with alcohol problem and are willing to quit or manage alcohol abuse is referring the patient to RAM clinic. So what is RAM clinic? RAM clinic or rapid access addiction medicine is a walk-in clinic that patients can attend to get help for a substance use disorder. It is a safe and healing space where an individual who has alcohol problem can seek support from a physician, nurse, and addictions counselor. So RAM can help a person who want to quit an alcohol by supporting substance use concerns such as alcohol. They will also help you an individual to reduce cravings and discomfort of withdrawal. They will also help the person to understand the different options for treatment. They will also help decrease the risk of relapse and overdose, and they will provide a safe and supportive and non-judgmental space. So the recommendation to emergency department is a continuous education for healthcare provider regarding the management of alcoholic patients, psych assessment to identify the patient's readiness to change, social work involvement, and family involvement. And the timeline is 6 months. The target outcome is to improve the patient compliance to 90%. So this is the summary of our topic, alcohol withdrawal, and the recommendation of our hospital, SHN Hospital. Thank you.